Whether you are planning a quantitative or a qualitative study, you must have an idea of the sample size for a number of different reasons. Importantly, effective planning of budget, resources, and time will require an idea of how many subjects need to be enrolled. In the case of qualitative study, how many interviews will need to be done. And of course, the IRB is going to want to know when reviewing your protocol. In quantitative studies, power dominates the landscape. In qualitative studies, saturation is the dominant practice. Kirsty Malterud and her colleagues from University of Copenhagen in Denmark and University of Bergen in Norway argue for the use of information power. I will now explain how this concept can be used to inform study design and review. The authors identified 5 dimensions that impact information power. To illustrate these key components of information power, I will use the example of a study to qualitatively evaluate the experience of patients undergoing diagnostic medical imaging. The authors also gave excellent examples in their paper of these components applied to the study of self-care in patients with diabetic foot ulcers. The first is study aim. If a study has a broad aim, it will require a larger sample. For example, if a study looked to evaluate the experience of all patients undergoing medical imaging at our facility, it would necessarily require a larger sampling than a study that sought to evaluate only those patients getting CT scans of the abdomen from the emergency department. The next is sample specificity. This concept gets at one of the keys to qualitative sample selection, specificity. If, for example, in our case, patients who had undergone more than one medical imaging study and have had more experience within our department, they might be able to provide more specific information. In order to tailor the study, we would need to have a mechanism for identifying these patients beforehand in order to tailor our selected interview population. As the authors wrote, accepting participants based on their availability without trying to influence the configuration of the sample implies the risk of more limited specificity, thereby requiring more participants. The next is established theory. This component relates to the theoretical background of the study. If a study can be built on established theory, either within social sciences or other areas, it may require a smaller sample size. In our example, if we wanted to explore the experiences of patients as they related to an area that had already been studied and had a theoretical framework, and we only sought to elucidate patient experiences within that context, such as patient satisfaction, this would require less interviews than if we sought to define a less studied phenomenon. The next is quality of dialogue, an interesting component that cannot be ignored. Given that the data is going to be obtained through interviews, the value of each interview is dependent on the quality of the dialogue between the interviewer and the interviewee. This can depend on myriad factors, including relationship, personality, experience level of both parties, language barriers. An example applied to any study is that it is likely to take less interviews for someone who is very knowledgeable about a topic or has a lot of experience with interviewing to get the same amount of information as someone who is a novice. The final component is analysis strategy. If a study seeks to define the whole range of experiences on a given topic, it will require more interviews. If it is only an exploratory analysis, it will require less. As the authors write, a single deliberately chosen and well-articulated participant might provide sufficient information power for descriptions of different experiences, but will likely not help to identify patterns. In our example, if the aim was to study a problem within our department, a single interview with a patient who had had a bad experience and submitted complaints about their experience might be sufficient to identify new information and problems that need to be addressed. But this would not necessarily provide much useful information about the wide range of experiences of patients undergoing medical imaging within our department. This diagram, adopted from Malterud's paper, helps to demonstrate the concept of information power components and how they might affect sample size. These are not the only components that can be conceived of as being a part of information power, but they serve as a starting point for discussion. Information power is not designed to produce an equation that can be used to cleanly determine the exact sample size. Determining even approximate qualitative or quantitative sample size for a study still requires a lot of experience and background research, but information power is a useful concept in this process. Another key component of using information power is that it should be assessed continually throughout the research process, from design through publication and review. In an interview study, the Malterud group recommends preliminary reevaluation of information power after the first 3 interviews. Information power comes up against saturation as a criterion for sample size in qualitative studies. As defined by Malterud and her colleagues, saturation occurs when the researcher no longer receives information that adds to the theory that has been developed. The authors argue that saturation, a key concept from grounded theory, is often inappropriately applied across the qualitative data analysis spectrum and that saturation is not as objective and indisputable as it might appear. Particularly when it comes to explaining your data and sample size to others, for example, the IRB or peer reviewers, discussing the components of information power could be informative. I leave you with this closing quote from the article. Information power indicates that the more information the sample holds, relevant for the actual study, the lower number of participants is needed.